Good day, I'm Stephen McHugh, and this is your JIS News for Monday, August 30, 2021. A shipment of desperately needed bulk oxygen arrived on the island early this morning to shore up supplies at hospitals struggling to meet the demand caused by increased COVID-19 hospitalizations. Minister of Health and Wellness Dr. Christopher Tufton says the shipment was secured and offloaded due to the efforts of the Public Health Team, IGL Limited, and Customs. He says Kingston Wharves had to send a special crew of crane operators to unload the ship at 1 o'clock this morning to accommodate distribution to hospitals starting at 4:45 a.m. The welcomed news comes after the Health Ministry confirmed on Sunday that all hospitals were facing low oxygen supply, some even running out and having to be supplemented. Up to Sunday morning, there were 723 hospitalizations for COVID-19, with 67 persons classified as critically ill. On Saturday, August 28, the island recorded 929 new COVID-19 infections and confirmed 21 deaths. The new cases moved the total number of infections to 66,663 since the first case was recorded last year, while the death toll climbed to 1,504. With these stark numbers in mind, the ministry is urging members of the public to get vaccinated against COVID-19. Vaccination appointments can be made online at moh.gov.jm or by calling the Vaccination Call Center at 888-1-LOVE. That's 888-663-5683. Once members of the public have their appointments confirmed, they should visit their vaccination site with their government-issued ID or a letter from the Justice of the Peace. Those due a second dose will also need to take their vaccination card. The Ministry of Health is also urging the public to remain vigilant in their adherence to infection prevention and control measures. These include mask wearing, maintaining physical distance from others, and frequently washing and/or sanitizing hands. Meanwhile, healthcare workers from several private hospitals across the island will be trained to administer COVID-19 vaccines at their facilities. This development follows a meeting with the Health and Wellness Minister, Dr. Christopher Tufton, senior officials from the ministry, and the leadership of the private hospitals. Dr. Tufton says this will help government expand its COVID-19 inoculation drive and meet the target of vaccinating 65% of the population by March 2022. He says the vaccination training seminar is to ensure that the ministry's standards are met and adhered to. The healthcare workers will be trained in cold chain logistics and management, health promotion and education, emergency services, management of vaccination sites, infection prevention and control protocols, and introduction to the COVID-19 vaccines. Over 100 school nurses will also participate in the vaccination training seminar. These nurses will now form part of the cadre of COVID-19 vaccinators who the ministry can utilize as it continues its inoculation drive in schools and communities across the island. Up to Saturday, August 29, over 512,000 doses of COVID-19 vaccines have been administered. In other health news, the Jamaica Injury Surveillance System, JISS, has received $5.2 million worth of equipment, technical support, and training to bolster government's capacity to track injuries arising from violence against women and girls. Spotlight Initiative Jamaica, a joint intervention of the European Union and United Nations Jamaica, made the donation to the Ministry of Health recently. The equipment includes 6 computers, 4 wireless routers, and 2 UPSs. They will be assigned to the accident and emergency departments of the Princess Margaret and Lionel Town hospitals. The Jamaica Injury Surveillance System, JISS, tracks violence-related injuries, accidents and unintentional injuries, suicide attempts, and road traffic crash injuries. Staff at the target hospitals will be trained to support effective collection and management of the data. This newest donation to the Princess Margaret and Lionel Town hospitals increases the number of JISS sites in A&E departments to 11 across the 4 regional health authorities. An additional donation of computers will be made to the Port Antonio Hospital by September. Major growth was recorded in the goods producing and services industries for the April to June 2021 quarter. The services industry increased by 14% over the period, while the goods-producing industry saw growth of 7.8%. Top-performing sectors are hotels and restaurants, with a 330.7% increase due mainly to a sharp uptick in visitor arrivals. There was a 50% increase for other services and 16.5% for transport, storage, and communication. Construction grew by a little over 18%, and agriculture, forestry, and fisheries up by 10.3%. Director General of the Planning Institute of Jamaica, Dr. Wayne Henry, says growth in agriculture was driven by a 17.6% increase in the category Other Crops. This reflected higher production in 8 of the 9 crop groups.
This performance was due to a rise in hectares reaped and output per hectare reaped. The most significant increases were recorded for potatoes, up 28.3%, vegetables, up 27.8%, and condiments, up 20.2%.
Dr. Henry was speaking at the PIOJ's quarterly press briefing recently. Residents of Standpipe in St. Andrew are now benefiting from a newly renovated sports complex. Situated on the compound of the Church of St. Margaret, it was recently refurbished at a cost of approximately $13 million. The sports complex comes equipped with basketball and netball courts, upgraded bleachers and restrooms, new changing rooms, a viewing gallery, and a refreshment stand. At the recent handover ceremony, Minister of Sport Olivia Grange said the facility would strengthen the community and assist in reducing crime and violence.
It is anticipated that the space will encourage the young people and other members of the community to engage in sports and physical activity to improve their overall health and wellness. And as we all know, sports is a unifying tool, and so it will help to get the community better bonded, working together, competing together.
Funding for the facility was provided by the U.S. Embassy in Jamaica, the United States Agency for International Development, USAID, Musson Foundation, and the Sport Development Foundation, among other public and private sector donors. Musson Foundation has committed an additional $600,000 in continued support to facilitate basketball and netball lessons for youth in the community. And finally, Prime Minister Andrew Holness is among the many Jamaicans expressing deep sadness at the passing of music pioneer and one of the founding fathers of reggae, Rainford Hugh Perry, affectionately known as Lee Scratch Perry. Lee Scratch Perry died on the weekend while under care at the Noel Holmes Hospital. He was 85 years old. The Prime Minister points out that Perry was a pioneer in the development of dub music in the 1970s and would work with many of Jamaica's other musical greats. His unique approach to recording meant that he was responsible for some of the greatest reggae songs, including Dreadlocks in Moonlight, Curly Locks, City Too Hot, and I'm a Madman. Lee Scratch Perry has received several highly and internationally acclaimed awards, such as the 2004 Grammy for Best Reggae Album titled Jamaican E.T. The government of Jamaica also bestowed Perry with the 6th highest national award, the Order of Distinction, Officer Class, in 2012. In paying tribute, Prime Minister Holness says Jamaica has lost the rhythm and soul of a prolific music icon who has inspired many, adding that Lee Scratch Perry was truly one of the most important and creative figures to have come out of the island. The Prime Minister also extended condolences to Perry's family, friends, his musical colleagues, and many supporters across the globe. And that's it for JIS News Today. I'm Stephen McHugh. Thanks for watching.